So, hello everyone. My name's Faye. I'm going to talk to you today about how you can use aromatherapy to help you feel better when you're going through cancer and cancer treatment. So what I'm going to do is I'm going to introduce myself properly first, so you all know who I am. And then I'm going to give a quick overview about how aromatherapy works, just so we're all on the same page. And then I'll talk about how to use aromatherapy to help reduce the side effects and symptoms of cancer and of cancer treatment, and to help improve your health and overall sense of well-being and vitality. So I'll explain how to use the oils with some specific methods of use, and I'll also give you some examples of specific oils for specific symptoms. So I hope it's going to be helpful for you, but please bear in mind that any recommendations that I give, they are generalized. So I can't give any personalized recommendations specifically for you, as I don't know your full health history. So I'll always have to caveat what I'm saying with please check with your primary care physician or a qualified holistic practitioner. But many of the oils in aromatherapy are considered safe to use for people with cancer or going through cancer treatment. So I'll talk about those oils and the safest way to use them. So the information that you're going to get is still going to be applicable. I just can't give personalized personalized recommendations. But at the end, I'll talk probably for about 30 minutes, and then there'll be plenty of time for questions. So please feel free to make notes as we go through, and then you can ask me anything you like at the end. Although, again, if it's anything specific about your condition, I will always have to refer you. Okay, so to introduce myself, my name's Faye Wilmot. I'm the co-founder of aromatherapy. We are a specialist supplier of aromatherapy products. So we supply many shops, including the Pennybourne charity shop. We also supply NHS hospitals, foundation trusts and pharmacies, and also lots of aromatherapists. So if you did go and see an aromatherapist, you could always ask for more natural products or whatever they recommend. So my husband and I started A More Natural about 10 years ago. I was using aromatherapy kind of at home for fun prior to that, but I've been using aromatherapy every day since. I would say I feel really passionate about aromatherapy because it's really easy and it really works. For me, the bonus is that essential oils smell so good, so it makes it a very pleasurable therapy. Which is really motivating, because if you love the aromas and you love the therapy, then it makes you motivated to do it, which I think means that if you do it regularly, you get the best results. So as I said, I use aromatherapy in some form every day, I would say, and I find it helps me with so many things. And because of the work I do, I talk to people all day, every day. My job is always on the phone talking to people about aromatherapy. And so I hear so many stories about how other people have used aromatherapy to help with their health and their well-being. So as you know, I know and we all know, it's a very effective therapy. I would say it's not an exaggeration to say that aromatherapy has changed my life. I'm so much happier and healthier than I ever have been before. And that's my hope for you too, to use essential oils to help you achieve your own kind of sense of optimum well-being, really. So that's a little bit about me. If I just summarize what aromatherapy is, so it's the use of essential oils. They're kind of the therapeutic compounds that we use in aromatherapy, and we use them to help improve our health and well-being, to bring our body back into balance. So it's considered a kind of a complementary therapy. So it's in addition to standard medical treatments. So it can be used to help people with illnesses such as cancer to manage the side effects of the treatment and or the side effects of the illness and or the side effects of the treatment. So it's all about bringing your body back into balance to help improve symptoms and improve your well-being. And how does it work? So aromatherapy works by using essential oils. Essential oils are they're what you can smell when you smell a plant. So they're the aromatic compounds. They're aromatic, they are volatile, which means that they dissipate into the air so that they rise up, which is why we can smell them. and they're also flavoursome. So if you think of ginger or peppermint or oregano, you can really taste them as well. So they're volatile, they are flavoursome, and they're aromatic. And they are really dense plant material. So there's thousands of molecules in each drop of essential oil, and each molecule has a therapeutic action within the body. And this is why plants have been studied for hundreds of years by the scientific community, because a lot of our kind of synthetic medicine is formatted from plants. So, you know, we all know that aspirin, for example, is a compound that's found naturally in plants, and now it's been patented and synthetically produced for medication. So plants are incredibly powerful. They have an impact on our bodies. It's either an immediate impact, and also it's an impact that builds up over time. So you can get the benefits of using essential oils straight away, and then you can also build up those benefits over time as well. So essential oils are wonderfully powerful. They work in 3 ways inside our body. So they work pharmacologically, which means that they impact the hormones in our body. So when you absorb essential oils into your body, they will affect the hormones and the hormone balance in your body, and that creates a therapeutic response. They also work physiologically, which means that they affect organ systems in our body. So if you wanted to have an impact on your digestive system, your circulation system, lymphatic system, detoxification system, any system in your body, you can choose essential oils to have an impact physiologically. And then the third way essential oils work is that they work psychologically. So you can absorb the essential oils and they have an impact on the psychological processes within our brains. So that can include anything from our emotions and our feelings, also our memories. But in our brains as well, I mean, our brain obviously controls everything that goes on in our bodies. So it can also control, if you inhale essential oils, you can affect your breathing rate as well, your heart rate, and also it has a knock-on effect on your endocrine system. So it can affect your, that's how it affects you pharmacologically as well. So all those systems are all intertwined, but those are the 3 kind of main processes, the main ways that essential oils can impact us. So pharmacologically, so hormones, physiologically, which is our organ systems, and then psychologically as well, which is how we feel and how we interpret what's happening to us. So essential oils are very powerful. They can definitely have a therapeutic effect on us, but how do we get them into our bodies? So there's 2 main ways that I always talk about. There is a third, which I will mention, but the 2 most powerful ways of absorbing essential oils is through inhalation. So literally inhaling the essential oils. If you open a little bottle of essential oil and inhale them, then those physical molecules from this liquid goes into our bodies. So we inhale the essential oils, or we massage the essential oils. So we apply the essential oil topically onto our skin, and it absorbs through the layers of our skin into our bloodstream. So I just want to just go into those two ways in a little bit more detail. So inhalation is a wonderful form of absorbing physical molecules, because it's the same process that we use to extract oxygen from the air. So the way our lungs take oxygen out of the air is the same way our lungs will take the essential oil molecules out of the air that we're breathing. So it's a very effective way of taking a physical molecule out of the air that we breathe. I know that I've spoken to some people who, one of the queries is like, how effective is inhalation? Because it just seems like we're smelling something nice. It's like having smelling a perfume. But inhaling essential oils is a highly therapeutic form of therapy, and you're literally taking the active molecules from this liquid that's in this little bottle and absorbing it into our bloodstream. So our lungs, if you were to lay out your lungs and flatten them out, they would be the same size, the same surface area as half a tennis court. So our lungs are massive. There's so much surface area to absorb essential oils. So we have it's a really high exchange rate. So you inhale essential oils, our lungs absorb the essential oil molecules into our bloodstream, and then our bloodstream transports it around the body. When you inhale essential oils through your nose, the first place it goes is into the olfactory bulb in our brain, and then it impacts the amygdala as well. So that's where we process our emotions and our memories. So that's a really that's why when we absorb essential oils through inhaling through our nose, it can immediately make you feel a little bit happier or a little bit more relaxed or a little bit more energized, depending on the properties of the essential oils. So it does have an immediate effect, and then as it gets absorbed through the bloodstream and it goes around the body and it starts working physiologically as well as pharmacologically, then those effects of the inhalation build up over time as well. So inhalation, very powerful form of therapy. Massage as well is when you apply the essential oils to the skin and then it absorbs through the layers of the skin. It's very important to use a carrier oil to do this, and that's to do with how the layers of the skin work. So the carrier oils just help draw the essential oils through the layers of the skin and then into the bloodstream. So essential oils on their own are very harsh, they're very strong. So if you were going to put them straight onto your skin, you could create a skin reaction as well. So it's always a good idea, it's highly recommended to dilute your essential oils in your carrier oil. The normal percentage would be between 2 and 5% essential oil to carrier oil. So the kind of 5% is 6 drops of essential oil per 10 ml of carrier oil. And then you can work out your dilutions that way. But the takeaway of this is to dilute your essential oils in a carrier oil, and then it enables you to put the essential oil onto your skin, and then it absorbs through the layers of the skin into the bloodstream. So those are the two main ways that we absorb essential oil, so inhalation and topical use or massage. But the third way that I do get asked about a lot is is internal use. So whether you would take them internally, so you would swallow the essential oils. I know that there's a few websites and a few companies that promote maybe putting a drop of lemon essential oil into your water in the morning, and that's a good detox. It's not something that I would recommend generally. Most reputable governing bodies for aromatherapy would say do not take it internally unless prescribed by a qualified practitioner for a specific acute reason. But in all other cases, don't do it internally. The reason being is essential oils are really potent. They can have a reaction to your mucous membranes, and so as soon as you put something inside your mouth, that's where your digestive system starts. But the whole of your digestive system, the internal lining, is a mucous membrane lining. So you can damage your mucous membrane lining, and you can damage your throat, into your stomach, and also it can upset the gut bacteria in your intestines. So essential oils are highly antimicrobial. They're highly antibacterial, antifungal, and they can sometimes don't differentiate, so they can just upset your healthy gut bacteria as well. So the general advice is do not take internally unless prescribed. So I'm always going to talk just about inhalation and about massage. Cool. Okay. So we've talked about what aromatherapy is, what essential oils are, and how it works, and how to use them generally. There's some specific techniques for inhalation, so either just inhaling from the bottle or doing a steam inhalation, which is where you have a bowl of hot water, boiling hot water, and you put a towel over your head, which creates, you put essential oils in the water, and then the steam creates a kind of steam inhalation. That's a really good targeted way of doing an inhalation. You can also literally just smell the essential oils straight from the bottle. You can also have an aromatherapy bath, which is a way of absorbing essential oils through the skin and having the inhalation as well, which is wonderful, and also, of course, very relaxing. And then for topical use, you can have a massage, But don't be put off by, you don't have to have like an hour-long massage with a professional masseuse. You can do a self-massage yourself, or you can literally just apply the oils to your skin like you might do apply a body moisturizer after a shower. So I'm going to talk now specifically about aromatherapy and cancer. So whilst there is no evidence that aromatherapy can cure or prevent cancer, the data just isn't there yet. There is plenty of evidence that it can help with both the side effects of the illness and the side effects of the treatment. So that's what I'm going to talk about. And indeed, the NHS, cancer charities and other medical bodies all recommend that you can use aromatherapy as part of your wellbeing programme, so as part of a complementary therapy whilst you're experiencing cancer and cancer treatment. So one of the most common things I get asked is it safe to use essential oils during cancer and the treatment of? And the answer is yes, it is definitely safe if you use them in the right way. So just to quote here, I've just got a quote on my screen. Safety testing on essential oils shows very few side effects or risks when they are used as directed. So, so yes, you can use essential oils. It is safe. What I'll do is I'll talk about some specific symptoms and some oils that I would recommend for those symptoms. And those oils are all 100% safe when used as directed. It's worth bearing in mind that some essential oils can create a skin reaction, and everyone is different. So it's always worth doing a patch test before use. It's the same as if you were going to get your hair dyed or get your eyebrows tinted. Your therapist or the beautician lady would always ask you to do a patch test in your ear. So with essential oils, we always recommend that you do a patch test on your forearm. And you leave it on for 24 to 48 hours and just make sure you haven't got a reaction. I know not everyone does that, but if you are prone to sensitive skin, I would say it's always worth doing a patch test before use, just to make sure you don't get a skin reaction. Some essential oils will make your skin more sensitive to sunlight as well. So if you're gonna use essential oils on your skin, it's worth just avoiding direct sunlight exposure for 12 to 24 hours afterwards. And some oils will make you feel a bit nauseous, so you just might not like the aroma. So again, worth trying before use, worth trying before you buy, I would say. So if you go to a health shop or a pharmacy, you should be able to get a sample to smell the oil before you buy it. I know that A More Natural does testers, I'm not sure about other brands, but it's just worth trying. Smell the oil before you commit to it. Just one note that I have to say, it is important not to use aromatherapy instead of visiting your GP or taking any prescribed medication. So it's not an instead of, it's an as well as. So there have been plenty of clinical trials actually focusing on helping people with cancer to help navigate the side effects of the illness and or the treatment. I'm going to give you just 3 examples. I find them really interesting. I hope you do too. So there was a clinical trial in 2016 to help people who had thyroid cancer and who were undergoing radiotherapy for thyroid cancer. In the radiotherapy, they use radioactive iodine to help treat the cancer, and radioactive iodine can destroy salivary glands, which is obviously a really unwanted side effect of the treatment. So aromatherapy was used to help see if it could mitigate and reduce some of that damage. So in the study, they inhaled lemon essential oil and ginger essential oil, and this study lasted for 2 weeks, and they found that those who used the inhalation of ginger and lemon essential oil had increased salivary production, which helped flush out this radioactive iodine that was used to help treat the cancer, and it significantly reduced the damage to the salivary glands. So that is one, I think, really cool example of how aromatherapy can help reduce the side effects of the treatment. There's also been there's been quite a few studies actually done on nausea, because I know nausea is quite a common side effect of chemotherapy. There was one study in particular with chemotherapy and women undergoing breast cancer treatment who had experienced acute nausea and chronic nausea, and they used ginger inhalation in this study, and there was a significant benefit shown for acute nausea. Not for chronic nausea, but for acute nausea, inhaling ginger essential oil was shown to have a significant improvement. And then another study done on anxiety and depression, which is a common side effect, also obviously for anyone else who might be experiencing anxiety and depression. There was a trial done on the difference between a massage just with a carrier oil, so just with a plain sweet almond oil, and then a massage with sweet almond oil and Roman chamomile essential oil. And again, it was a 2-week trial, and after 2 weeks there was a decrease in anxiety and a marked improvement in the symptoms for the people who had the massage with the Roman chamomile essential oil. So massage on its own is therapeutic. It can increase circulation and lymphatic drainage and help with detoxification. Also, there is that kind of physical touch element where you just feel like you're being nurtured and looked after. So massage is wonderful. Massage with essential oils is even more significantly therapeutic. So Roman chamomile is the one that they studied there for anxiety and depression, and it had a marked improvement on symptoms. So there has been scientific trials on aromatherapy for people undergoing cancer and cancer treatment. I've just mentioned 3 side effects there, but just to list a few others, we can use aromatherapy to help with, well, I've mentioned nausea, exhaustion, stress, negative emotions, insomnia, inflammation, increased infection rate, pain, appetite, IBS, kind of digestive issues, muscle and joint pain, nervous system dysregulation and breathing rate dysregulation. Aromatherapy is really good for both those two because it works on the nervous system, and also water retention. So yes, there's lots of symptoms that aromatherapy can definitely help with. And it is also generally considered safe for those, even if you are going through treatment. What I also love about aromatherapy as well is it's not just about kind of popping a pill, it's not just about taking a tablet. It's quite an interactive therapy that you can give to yourself, and I think that that's quite a really positive message. It's a message of self-love and self-care and giving yourself that time as well. And like I said at the beginning, the aromas are really nice, so it's a pleasurable therapy to do as well. So I'm going to give you some specific examples of oils that you can use for those symptoms. Nausea, which I know that we talked about when I talked about the studies, but I would say if you're experiencing nausea, definitely try an inhalation of ginger essential oil, and you can literally just smell it from the bottle. I actually had a friend recently who she's pregnant and she's experiencing really bad morning sickness, and she says that ginger inhalations have really helped her. She also has ginger tea and ginger biscuits, but just ginger generally is really good for helping with nausea. So I definitely recommend that one. And again, I would recommend it as an inhalation. You could do a body oil massage and just massage it on your abdomen. That's another option. I just think inhalation is really quick, really easy. So I would recommend that. You could also try peppermint. If you don't get success with nausea, if you don't get success with ginger, try peppermint essential oil. If you have acid reflux, I would avoid peppermint though, because it slows down your stomach from emptying its food. So it's just, it can create some acid reflux. So avoid peppermint in that case. But if you don't have acid reflux, definitely try peppermint, because peppermint tea, for example, is really known to be useful after if you eat a big meal. So for nausea, ginger inhalation is wonderful. If you have any appetite issues, so if you have a low appetite or a really irregular appetite, scanty appetite, then I would 100% recommend bergamot essential oil. Bergamot is a citrus fruit, and it's grown all over the world, but it's predominantly grown in Sicily and Italy. So it's a big green fruit, and it's a bit like an orange, but it's green. I believe it does go orange actually. But what I like to think about bergamot is it absorbs the Italian sunshine. So it's a really sunny, citrusy fruit, and it smells amazing, and it's really good for regulating your appetite. It won't make you ridiculously hungry, so don't worry about that. It just balances your appetite, so you have a healthy appetite, so you have the appetite to eat the meals that you need to eat. It's also really good for depression. So as I said, it's like a sunshine oil, and it alleviates depression. Really good for kind of low mood, that kind of Monday blues feeling, or if you just can't be bothered to get out of bed. Bergamot essential oil is a wonderful oil for that. Just incidentally, we have a blend called Happiness, and one of the main ingredients is bergamot, and it's lovely, and it really does make you feel happy. So just backtracking a bit, appetite. For appetite issues, I would recommend bergamot essential oil as an inhalation, and also for depression and low mood, I would also recommend bergamot. So that's very safe to use and very effective. So keeping on the low mood topic, negative emotions. If you're feeling, I would say for any negative emotion, if you're feeling teary, sad, scared, anxious, actually maybe not anxious, I've got other recommendations for anxiety, but low mood, sadness, teariness, emotion, kind of issues with emotions, neroli is the best essential oil for that. So neroli essential oil is a wonderful oil, or rose. Rose is really good for self-love, and it's got the affinity with the feminine as well. So rose is really good for love and self-love, or neroli. And I think in those kind of moods, I would highly recommend an aromatherapy bath. So you would need to dilute the essential oils in a carrier oil and put it in your bath. After the bath has run, not whilst the water's running, add your essential oils. Excuse me, hang on. So add your essential oils after the bath has run, and then have a aromatherapy bath. And that's a really good thing to do when you're struggling with negative emotions. So that's neroli or rose. You can also do an inhalation, because any emotion is, if you're feeling any emotion, inhalation is a really quick way of absorbing the essential oils up through into your olfactory bulb. So that's a really good way to use aromatherapy for any. Inhalation is the best way, I think. But when you're having an aromatherapy bath, you're also having the inhalation as well as the complete relaxation and the gift of time to yourself. Anxiety and stress, I would say Mei Chang is wonderful for anxiety and stress. It's the oil of tranquility. So it helps calm you down. It has a really positive response on your nervous system, but it doesn't make you sleepy. So if you are really stressed and anxious and you're worrying and you've got that worrying brain, but it's daytime and you still need to go to work or do some jobs or go to an appointment, Mei Chang's brilliant for that. So it will calm you down, but without making you sleepy. It keeps you productive. It's one, incidentally, I always recommend for people who are going to have a driving test or maybe an exam or something. So it will keep you on the ball, but it helps reduce the stress. Clary sage is...
How would you spell Mei Chang?
Oh, sorry. Mei Chang is M-A-Y, and then the second word is C-H-A-N-G. Cool?
I'm putting it in chat. Great.
Say that again? Oh, you put it in chat. Cool, okay. Okay. I can't see the chat at all at the moment, by the way, so if anyone is asking me any questions, I'm sorry I can't see that at the moment, but I will see that at the end. Or Marcus will help me. Okay. So stress and anxiety, Mei Chang is the oil for that. The other one that's really good for stress and anxiety is clary sage. And I also sometimes recommend this one for depression. So for depression, I recommended bergamot, but clary sage is also really good for depression or stress or anxiety. And it's like a euphoric oil. So it's quite kind of, euphoric is the best word for it. It could be quite stimulating, but in a really positive way. I also recommend it for PMT and that kind of like frazzled, nervous, emotional energy. So clary sage is really good for that. And then the other oil to recommend for stress and anxiety is geranium. Geranium is really balancing. It's very floral, rosy floralness, but very balancing. So it balances your hormones and it balances how you're feeling. So it just depends on how you want to feel when you're experiencing stress and anxiety, whether you want Mei Chang to be uplifting and help you be productive, whether you want the clary sage for the euphoria, that real lift to your emotions, or the geranium to help calm you down and give you that kind of rosy comfort. And again, with any kind of emotional issues, I always recommend inhalation is the most effective form. But you can also have if you could do an aromatherapy bath, that'd be wonderful. Wouldn't it be great if we could all just have a bath in the middle of the day? Okay, so sleep. If you're having trouble with sleep, lavender is always the number one oil for sleep, I would say. But if you want to try something different, or if you want to add to your lavender, vetiver is amazing. So vetiver is taken from the root of a grass, and anything that's any essential oil that's taken from the root of a plant is going to be very grounding. So vetiver is very grounding. It's got a very deep, heavy aroma, and so if you kind of helps give you that feeling of being grounded and comforted. So if you mix vetiver with lavender, it's amazing. But vetiver is very strong. It's a very heavy aroma. So I would say put 3 drops lavender, 1 drop vetiver would be my recommendation. And chamomile is another one for sleep. So I think, in the study that I spoke about earlier, chamomile was the essential oil that's really good for stress and anxiety and helps you sleep as well. So for sleep, lavender, vetiver, or chamomile. Again, aromatherapy bath, or if you could have a massage, that would be wonderful. Even if you self-massage yourself, so literally just massage it onto your skin. Sorry, just turn that phone call off. The other thing for sleep as well, what I do, I just drop a few drops of essential oil on my pillow, and then when you lie down, you can just smell the aromas coming up from your pillow. So that's a really easy thing to do. And then I've just got one more recommendation for how we're feeling. So energy. I know that sometimes you can feel absolutely drained and have no energy, no inclination to get up. So for those times, I fully recommend rosemary essential oil or peppermint essential oil, and they will definitely give you this energetic lift. Even just smelling from the bottle is so good. We do have an energized blend which is made from rosemary and peppermint and a few other oils, but it really does give you that lift. I actually diffuse that one in the office quite often, especially when, like in the afternoon when it's a bit flaggy, the vibe is quite tired. So if we diffuse energized essential oil, which is full of rosemary and peppermint, it really does help kind of give that lift in the office. So I highly recommend a diffusion of peppermint or rosemary, and any citrus oil like bergamot, grapefruit, lemon, mandarin, orange will just give you that lift as well. And a combination of those. Feel free to combine and blend your oils as well. So those are my main recommendations for the symptoms of cancer or cancer treatment. Just a quick note about dry skin, because I do often get queries about dry skin. If you're looking for an oil for your face, it's not an essential oil, but it's a carrier oil. But rosehip oil is wonderful for dry skin on your face. And it also helps with any scarring. And then if you want an oil for your body, I would recommend coconut oil or jojoba. Is really good for your body, for dry skin on your body. And if you're looking for an oil to help with hair regrowth, castor oil helps stimulate the follicles. So I've had lots of people tell me really positive things. You can even put it on your eyebrows, on your eyelashes, and it really helps with hair regrowth. And obviously you can just put castor oil and massage it into your scalp, and it helps with your hair. If you're looking for the quality of your hair, so if you've got hair and you're looking for it to be strengthened, add argan oil. So argan is really good for the quality of your hair. and then castor oil is good for the follicles. And if you want to add an essential oil to your hair oil, rosemary is really good for dark hair, chamomile is really good for blonde hair, and cedarwood you can use for either light or dark hair. But that would be my recommendations. So I hope you found that useful. That's all I've got prepared for you, but please do ask any questions and I'll see what I can do.